I hope you
Good
can hear
evening,
me.
Prof. Good evening, Prof. Good evening, Prof. We can hear you.
Yeah, okay. Thank you. So we can we'll start the lecture on methodology, writing of research methodology. We started yesterday, and we did the introduction, all the subsections under introduction, the literature review, and then we did one or two aspects of methodology. So, it's likely that we are going to, in fact, we are going to conclude the lectures on the proposal, on this proposal writing. And it is expected that you use the knowledge to start the writing of your proposal, especially when your topic, once your topic is approved, you can now start and at least start something before start something that you can send for the review of your supervisors. Before I continue, let me say something about the short courses. I'm sure that we have seen the short courses. Already, I think one of the first, in fact, the first question, the rep asked me was whether it is optional. Yes, it is. It is, but I'm actually very surprised that that is one of the first questions to be asked. Yeah, because those short courses are designed to make, designed to give you that competence, the competence to truly be a holder of the MPH degree. Let me also tell you, especially those of you, in fact, majority of you are in MPH. The MPH is a professional. It's a professional master's. It's a professional master's, and it used to be. In fact, it's in fact, it is the highest professional qualification required for the practice of public health. So, and if honestly, and of course, it is internationally recognized. The MPH is the most internationally recognized public health degree. It's known the whole world. In fact, we just completed, we just finished the conference of Association of Public Health, of Schools of Public Health in Africa, that held in Malawi. And it's becoming and it is one thing that came out of it is that the curriculum of MPH programs are almost the same worldwide. In fact, there are things that a holder of the MPH degree must know and must know. In fact, in some countries, several countries, especially in developed countries, MPH programs are accredited. They are accredited. Although that accreditation is voluntary, but it ensures that the holder of the MPH degree from an accredited institution has that competence. So MPH is not just a degree. It's not just a degree. And we have to emphasize the fact that it is a professional degree. Although in Nigeria, we have made it both professional and academic. So you can use it to go up and do a PhD, okay? But first of all, an MPH is a professional degree. And professional degrees, they put a lot of emphasis on the competence. It is not theory. It is not theory. So if you just know, if you are just taught without emphasizing the professional aspects, you don't have a truly MPH degree. So I don't know. So it is in a very bad mindset for people to they are just interested in having the MPH degree. Yes, they just want to have the degree. And if you have the degree, and some of you, a lot of you we want to travel outside. If you travel outside and you want to seek a job and you are employed with the MPH degree, they will expect a certain level of competence. And if you don't have it, they will ask, where did you get the degree? And in the process, you have brought the School of Public Health, the University of Port Harcourt School of Public Health into disrepute. And that's why we do all the things. We overstress ourselves to make sure that we give you the best training so that if it is mentioned, our conscience will be clear. We won't share from the blame. We will say that we trained you well, but if you fail to acquire the competence, you have yourself to blame. So as much as possible, I know that in a country like ours, people don't competence is not even emphasized. So people are given jobs based on their paper qualification without any requirement to demonstrate. But if you want to work in an NGO, the NGO will expect you to show working. The NGO will expect you to show working. Okay? And if you don't show working, you will somehow, because it's a result-oriented result-oriented workplace, they will show you the way out. But at least you can anyway, you can escape it if you get a work in government service, in the public service, where competence is not emphasized. So please, I want to encourage you all. To look for the one. Anyway, with the School of Public Health, we have also decided that at least we are going to pay. We are going to pay for at least one course to ensure that at least you have that certification, at least one certification. Okay. So we have actually done our best, and then in my area they used to say that it is always good to do your best, to do all the sacrifice, behave well, so that if life doesn't, if you are not comfortable, if you don't succeed, you don't blame yourself, but rather you blame the spirit, because you have done everything that is expected from you. I don't know, the hands are up, but I don't know if, we can hear from them before we continue. But I'm just okay. So we can just quickly hear from them before we continue with today's lecture. Abarefo. Hello, madam.
Good evening, sir.
Yeah, good evening.
Please, sir, I want to ask, is it possible for us to just do just one of the short courses?
Yeah, it's possible. The one the school has paid for you. Yeah. Oh. If you think that is the only thing the only one you need, no problem. Yes. Hello, Macaulay.
Good evening, Prof.
Yes.
Okay. So I just also wanted to get clarity. If the school is paying, if it's the same ones that we filled during our course registration.
No. As we said that, if you notice that they have changed, I think I don't think that all of them. In fact, I have not looked at the one that were filled, but the ones that are advertised are the ones we have the curriculum. we have packaged something for, because it takes a lot of effort to package these things and make them get the right instructors to do that. So I don't know. So you have to do it afresh. We're not going to look at what you have already registered.
Okay. So just to confirm, Prof, are we the ones to select the courses that the school will pay for us?
No, it's which one is this? We say we are going to whatever one we are going to pay for one, for all, for everybody, anyone, right. Anyone for everybody. Yes. Yeah. And Namde.
Good evening, sir.
Yeah, good evening.
Okay, so my question is for some of us who came in from PGD. The same advert was given to us, but different courses we are seeing now. And some of us had already paid for the courses because there was this subsidy that was given to us if you choose 3 courses and being a student of SPH, that you'll get some reduction. So we paid, and some of our friends who are not students also, we could encourage them to. So what do we do now, sir?
No, I think it will be acknowledged. But if the courses have changed, you can just choose from your available ones. Because why we couldn't hold it last year was of course time constraints and of course the fact that we were unable to package those courses. But all the payments made last year will be acknowledged. In fact, we have to even find a way to compensate as a way of apologizing for the non-show. Okay, I hope I answered that.
Okay, yes, sir, but yeah, for me in particular, how do I go about it now? How do I choose?
Just register.
I will know I will not be
register.
paying again.
Just register. At that point, we'll be able to sort it out. Or I think I have to liaise with the IT person to find out how to accommodate persons like you. Okay.
Okay. I will also reach out to other people who are not students but came in, applied because we told them to do.
Yeah, please. Yeah, please do. Please do. Yes. Hello, best man.
Thank you. Is there need to re-forward our receipt? Is this necessary?
Okay, I don't know. I think we will give you further information because we need the information, because one thing we also notice is the fact that some people registered but they did not follow up with payment. So we have to, yeah. So perhaps it may be necessary to also cite the receipts if you have them. Okay.
Great. Thank you.
So I just want to find out concerning the short courses. Is one allowed to attend, register for all, or just a particular one? And if it's a particular one, is this the school that is selecting for us, or we have to choose any one of our choice?
Best man, I'm going to repeat it. Somebody asked a similar question.
Okay.
There are multiple courses, and you are expected to choose from them. But the school will pay for one. And if you are interested in multiple, more than one, then you have to pay for those additional ones. That was exactly what Abiripo asks. One,
Okay.
yes, and so we expect every student to at least register for one, and that may be enough depending on what they need. In fact, there is actually one anyway who is interested in nearly all, but yeah. Madam, your hand is up again, or is it an old hand?
No, sir, it's not an old hand, it's a new hand. I want the registration, sir. In the link sent, like the link underneath the flyer, if you click on it, you do your registration. If you say submit, it just ends. Nothing actually happens.
Yeah, I'm sure that the IT person hasn't completed it. I will remind him. Okay, thank you. Yes, isn't it? Yeah.
Hello,
Hello.
sir,
Good
can you hear
evening,
me?
sir.
Yeah.
Good evening, sir.
Yeah, good evening.
Please, sir, please, can we know the cost that School of Public Health will be paying for us so that we'll not go and pay for it again as the second short course?
Madam, we left that option open for all of you now. If you are interested in systematic review, and it is only one you want, then that is all right. I will pay for you now. You pay for you, but it's only when you have chosen more than one that you have to pay for that extra. Okay. Thank you very much.
Okay.
I think we can now move forward to
Please, sir.
yes.
Hello, sir.
Yes.
Please, sir. I want to ask a question regarding the what are they calling it, for submission of project topics. The last question there that said we should suggest a supervisor, not academic, that can bear the logistics and that is competent and can bear the logistics of the project. I don't really understand it, sir.
I said, suggest a supervisor who is not necessarily in academics, but who
Yes,
has
sir.
the competence and the network to help with the logistics of carrying out the study. Do I need to
Yes,
explain
sir.
it for you?
Yes, please explain it for me because I'm confused.
No, the person now is not your supervisor. Doesn't need to be a lecturer in any university. He can be somebody, a professional in an NGO or Ministry of Health or the ministry or anybody. But he should be able to help you. We are saying something about, we said something about there are some hospitals or even some NGOs or people with data that they will not allow you to access their data except you get someone involved. And we said that the easiest way to get the head or somebody involved in that place is to make that person, get a supervisor in that place, and it will be possible to make it possible. That is why we said that. But please, don't. If you don't have any person like that, please don't bother. Don't bother because people have chosen people, those that have zero competence, and they have caused a lot of problems because they messed up the whole thing. They messed up the whole research, and we are finding it difficult to get their work ready or good enough for the external examination.
Okay, sir. That is just for me to clarify. Thank you very much, sir.
Hello, Joanne.
Good evening, Prof.
Good evening.
Yeah, sorry. So just a quick one. I just wanted to find out if in the report for the research topics, you said put three topics that are. Is it the three topics you have to submit? Must they be related? For example, you're interested
No, they are not.
family planning?
They are not. They are not. They may not. They may not. You can choose anything. You can choose.
Anything.
Yeah, but we just want a situation where we'll be able to find some, make sure that we'll have at least a topic that you can, that is researchable at the master's level. Because if we tell you to just submit one, a lot of you will just go and submit a seminar topic. Seminar topic that you
I think
cannot.
they will choose one for us. They will approve one.
Yes.
Okay.
Okay, so we can let's continue. So we are going to. Yesterday we started with. We said the proposal has 5 components. In fact, 3 main components, 3 main sections, and 2 appendices. The first one is introduction. The second one is a brief literature review, particularly the theoretical framework. And then the third one is the methodology. The first and the third ones, the first and the third are very, very important. We are through with the first, the second. We started the methodology. We told you about the different subsections, and considering the fact that we don't expect the proposal to be voluminous, but if you notice if you notice the introduction has a lot of subsections, and the methodology even more subsections. We'll expect you to just write few lines under the subheadings, under these subheadings, but they must be relevant. They must be relevant. We told you study area, what to have, what you should have under study area. So if you are carrying out the study and you say it's a rural community, please, you have to give us the characteristics. What are the things that make that particular community a rural community? Well, if you say that place is you are doing a study in a tertiary health facility, you must tell us why it is a tertiary health facility, not just in name, not just in name, but you have to also say that. You have to give us so that the findings of that your study can be comparable, can apply to other places that have similar characteristics. We said that of the study population, where you are carrying out the study, you have to not only tell us that about the study population, but you can give us information about them, so that when we are looking at, when people are reviewing the book, they want to find out if married women in Rivers State, whether they are the same married women in northern Nigeria, whether they are the same, whether married women in Rivers State are the same with married women in Kano State. You have to, so that's why you have to tell us. You have to tell us probably the marriage institutions, especially when you are doing it in certain communities. We did tell you that yesterday that interestingly, in Rivers State, marriages are actually traditional. Of course, we know that marriages, even in Nigeria, are of 3 types. You have the religious marriage, or what people call the church or the mosque marriage. Then you have the traditional marriage, and then you have the court marriage. And but we also know that even in Rivers State, the traditional marriages are in different grades. So you have to give us such characteristics. We also gave examples of an example of the market women in Enugu State, market women in Ubwete market in Enugu State. You want to find out, you have to give the descriptions so that the reader will be able to, the reader in Lagos will be able to just be able to compare with, say, market women in a Tejo show market in Lagos. So that is the reason why you have to give us those information, okay? And not some of those one-liners that I used to see in even in the dissertation. Then we talk about the inclusion and exclusion criteria, where you precisely define the study population, precisely define this study population, those that are included and those that will be excluded. We told you that for those to be excluded, you had already included them. So in other words, you cannot exclude those you didn't include. You cannot exclude those you didn't include. So you cannot be carrying out a study in amongst married women, and then you go to the exclusion criteria and say you are excluding people that are not married. No. You can't do that because you didn't include single women. Okay. Then today we're supposed to start with the study design. You know, when we told you about when we discussed the appropriate study methods, studies for the masters, we told you that of course you have short period, 6 months. 6 months. You have about 6 months to carry out, 6 months or even less to carry out this study. So, which means that you should be able to carry out the study within everything about the study within 6 months. So, and we said that because of that, cross-sectional studies, you are likely to carry out cross-sectional studies. But I must add that there are some so-called short duration intervention studies. For example, you can do a health talk. You can do an educational intervention, and within that educational intervention, you can do it over 1 month, and then do before and after. That we can say intervention short duration. Remember that, for example, that's they advertise the short courses. They can be an intervention before what you knew before the short course, and then after the short course you can take a post short course test and just compare the two. In fact, at times we can even structure it that way. Okay, so you can do mostly short duration studies, and that will include cross-sectional studies and short duration intervention studies. Intervention studies that you can carry out the intervention within a few weeks. You can carry out the intervention within a few weeks, and the intervention should be able to have measurable changes. And the thing I have to also emphasize is that descriptive cross-sectional studies are not allowed. Descriptive cross-sectional studies are not allowed. Why? Because you must do at least a bivariate analysis. And that makes it, that pushes it into what they call analytical cross-sectional studies. Analytical cross-sectional study. Okay. Remember, we said that even if you are doing a CAP study, where you assess knowledge, attitude, and practice, we'll expect you to determine the factors associated with the practice. And that will require the cross-tabulation between practice and knowledge, practice and attitude, practice and the social demographics. Okay, so that is the study design we are likely to have. Then study tools. Study tools are what you are going to use to collect the data. Study tools are used to collect the data. They are used to collect the data. And the study tool you are going to use are actually determined by the set objectives, your objectives. Okay? the set objectives. And study tools are actually of two types, qualitative and quantitative. Quantitative, they are able to measure, they measure in figures, while qualitative, they actually collect the data in words. They actually collect the data in words. Okay, and the quantitative data collection tools, which you are going to use, a lot of them include a questionnaire, checklist, proforma interview, proforma, which you use to extract secondary data, in situ measurements, especially those of us in occupational health, you are going to do. So if you are asked to do noise level, you have to actually mention noise level, air quality, you have to measure, and so forth. And then anthropometric measurements. Those are the common ones we are going to use. And for the qualitative, where you assess, where they collect the data using words, key informant interview and focus group discussion. Okay, so those are the study tools we should be able to use. State the study tools you are going to use. State the study tools you are going to use. Okay, state the study tools you are going to use. Okay, and we are encouraging you to use what they call the mixed method study. Mixed method study is when you combine quantitative study tools with qualitative. We are increasingly encouraging you to do that, because they add more depth. They add more depth to your findings. They add more depth to your findings. There are certain things that cannot be measured just with yes or no. But there are certain things that you need to capture the words. They capture the words of the respondents to at least add probably the emotion to the findings. Okay, emotions to the findings. Okay, so we are encouraging you that even if you are carrying out a study, say on family planning, immunization, malaria control, all those vertical programs, all those common vertical programs, it will be nice not only to deal with the data, but also to interview the key informant, but also to interview the key informant, not just the data, but interview the key informant, the person that generated the data, HIV control, TB control, not only to use their secondary data. You should also interview interview those that generated the data to add more context, to provide more context. Okay, the sample size is the total number, the minimum, the total number you need to study to ensure that that sample is representative. The sample is representative. Okay, remember that you will not be studying the whole population. You will be studying just a fraction of the population, and to ensure for you to make statistical deductions, that you must use a minimum number. You must use a minimum number, and the number that is needed in a study, it is not what you just decide. It's not just what you decide. You have to decide. You have to determine that using a formula, using what they call the sample size formula. And there are several sample size formula. But this sample size formula, they take into the consideration the study tool, your study tool, the precision you want, how precise you want the measurement to be, the proportion of the population with the health problem, the study design, and the possibilities of dropouts. They are all factored into the study design, sample size, and there are basically two types of too common. No, yeah, there are other types, but the ones that are mostly used, commonly used in public health, are the Terry-Yemen's formula and the Cochrane formula. The Terry-Yemen's formula we don't particularly recommend it, although it is commonly used in social sciences. It's commonly used in social sciences where they don't know. At times they don't know what they are measuring. They don't know what they are measuring. But in public health, in epidemiology, we like to measure. We like to measure. And that's why they taught you prevalence. They taught you prevalence. So in Terry-Yemen's, they are used mostly where they don't. They are used mostly where they don't know what they are measuring, the prevalence of what they are measuring. But in public health and epidemiology, we try to, even if you are studying an abstract concept, we try to precisely define it in such a way that they become almost tangible. For example, physical activity. Physical activity. Physical activity. The WHO, they have made that, they have precisely defined physical activity, the recommended physical activity, or that you must, physical activity has been defined. The difference between whether you are physically active and inactive is based on the definition that the other person should be capable of doing 30 minutes of moderate to severe, moderately intensive physical activity, 30 minutes at least 5 days in a week. 5 days in a week. That is 150 minutes of physical activity in a week. Okay, so even for physical, even for abstract contest, in public health, they usually will define it in such a way that you can categorize people into whether they have it or they don't have it, whether they have the disease or not. And that's why we don't like the Terry-Yemen's formula, because it doesn't take into consideration. It doesn't take into consideration the prevalence of what you are studying. And the fact that it relies so much on population. We rely so much on population. How many are we in Nigeria? If you ask, they will give you several figures. They will give you several figures. So we don't actually know. We don't actually know. The last census figures that were not disaggregated to communities, but rather stopped at local government. So we don't have very good census figures. So that's why we don't encourage you to use this Terry-Yemen's formula. In fact, if you see it even in your proposal, we know that you took it from an extraneous source, and that extraneous source is likely to be from a contract service provider. So we don't want that. We want you to use Cochrane formula, because it takes into consideration the prevalence, the P. There's P there. It takes into the prevalence of what is being measured, okay? And then, yes, what is being measured. And some people will say, the Cochrane formula will give you a figure, probably usually more than 200, usually more than 200. And some people will say, how can I, what if the study population is less than 200? No. That is actually a correction factor, because the Cochrane formula is actually designed for a population of more than 10,000. So, but the good thing is that there is a correction factor. I say for a correction factor that can be applied. Okay, so that is that. And not only that, there are other ways. There are other sampling. What we have mentioned is when you are sampling, when you are studying a population, when you are studying human beings, but not when you are, say, studying, carrying out water quality analysis. Water quality analysis. You don't need, or when those in occupational medicine, if they are doing a walkthrough, you don't need to calculate the sample size, and the sample size will now determine the number of samples you are going to collect. No. Or you have to do it using other methods. You want to, the main purpose of sampling or sample size is to make sure that they are valid. They are representative of so if you are doing say water quality or something, or even air quality, you can stratify. For example, if you are assessing the water quality, if you are carrying out the quality of the drinking water in the community, you can stratify the sources: rainwater, hand-dug well, borehole, and stream. And then you can make sure you can collect at least one samples from each of them. And when you do that, they will truly be representative. They will be truly representative. Okay, the next one is the sampling method. Sampling method. Remember, how do you select your respondents, or how do you select the subjects from the total population? We want it to be representative, and the way to be representative is for you to use the probability sampling, where every person that is chosen has a known chance of being chosen. What is a complete no-no? What is a complete no-no is convenience sampling. We don't want to see it anywhere. It's a haram. It's a cardinal sin. Let us call it a cardinal sin, because once you mention it in your dissertation, that is the end of your exam. Because it means that your sample is not representative. And if it is not representative, it means that your records, your results are not valid. And if your results are not valid, it means that nothing to discuss. So please, we don't want to see it. I know that when we do in practice, a lot of us do some convenience sampling. We just go share this questionnaire. But you can share the questionnaire, but in practice, please, when you are writing it up, don't say you just share the questionnaire, because once the examiner sees it, you will be in very big trouble. Okay, I'm sure that when you were taught in epidemiology, they taught you the different sampling methods. There are 4 sampling methods, main sampling methods. The first one is simple random sampling. Okay, the first one is simple random sampling when you have a sampling frame. A sampling frame is the list containing everybody. It's a list containing everybody. So a simple random sampling can only be used where you have a list of students in the School of Public Health. That's a list. You can therefore use simple random sampling, where you randomly select. Some people will say they do balloting. They do balloting. They write the names. They write the numbers from 1 to 1 million, and then choose. Well, that one is O-level standards. Okay, but at the master's level, you can decide to use a table of random numbers, and then generate those generate the random numbers, and then use them. Okay. The second one is the systematic sampling method, where you don't know, where it is very difficult or impracticable for you to have first generate the list. Well, for example, if in a clinic you don't actually know the number of patients that will come to that clinic, or you can estimate based on past numbers, based on past attendances. So you can just use that, and then divide by the sample size to give you what they call the sampling frame, So that is systematic. Then we have this cluster. Cluster sampling is used when the subunits of the total population are basically the same, such that when you study one, you have studied all. When you study one or two, you have studied all. Okay, which means that you can take a cluster. You can just take one and then study all one or two. Okay, whereas the certified sampling is used when the different sampling units, when the subunits are not the same. So because they are not the same, and you want a representative sample, it means that you have to take a little of each of them to study. Okay, so that is that. Those are 4 main sampling methods. But most of you, or for your study, you are going to use a multi-stage. Multi-stage sampling is when you have different stages. You have different stages that you have different stages, and you have to select different stages. You have to select. If you are doing a study that is statewide, it means that you must have the states will usually have local government, and local government will have ward, and in the ward you have what they call the enumeration unit areas, EAs. EAs are, if you notice that even in the ward, the EAs are usually used by MPC. They are usually used by INEC to determine the polling units. They define the polling units. In fact, the MPC, the original National Population Commission, they are the original owners of the enumeration areas. So enumeration area can consist of streets. It can consist of streets. So you can do that. So when you have such, it means that you can sample at different stages. You can sample at different stages. To carry out this multi-stage sampling, you have to first of all, at each stage, you have to check the homogeneity. Check the homogeneity or otherwise of the population, and then decide on how to select. Okay. For example, if I'm doing a multi-stage sampling for Rivers State, I'll just, the first stage, after at the local government level, I'll be thinking, are all the local government areas in Rivers State homogeneous? Are they all the same? The answer is no, they are not the same, because you have urban local government areas, you have rural local government areas. Okay, and even in Rivers State, you have in the rural local government areas, you still have upland and riverine. So in Rivers State now, the best thing is to stratify Rivers State into 3: the urban, the rural upland, and rural riverine. Okay, so you can stratify the local government areas into 3 and then select. You can select one local government area each from each of these the stratum. Okay, so that is that. You must always look for the homogeneity. And then when you get to the local government area, the next under the local government areas are the wards. The wards may be the same. So so the wards are homogeneous. So you can select one ward from a certain number using a simple random method, and then you move down. Well, when you get to the selection of the respondents, there's a likelihood that you are going to use systematic, because it is difficult for you to have the list of everybody. It is burdensome to have the list of everybody in the community. So instead, you can estimate, and then with your sample size, determine what they call the sampling fraction. Okay. The other thing too, I have to also mention, especially when it comes to multi-stage sampling, is that multi-stage sampling, there must be a choosing. You must always choose in each stage, in each stage of the multi-stage sampling. And that means that you are likely to have more than one step in a stage. So you can, for example, for example, you can, if you have to stratify the population, into, say, rural, urban, you have not chosen. You into rural, urban. At times, you have to determine the total number of respondents for you. The total number of respondents you are going to, the total number of questionnaires you are going to administer to each of the areas you have chosen. Okay, that is a proportionate allocation before going ahead to choose. So there can be different steps for the same stage. Okay, and I must also tell you that this sampling method we have talked about is not for qualitative. It's not for qualitative methods. So if for qualitative methods, you choose persons based on their ability to give the necessary information, in a community, at the community level, okay, based on the ability to give the necessary information. And the common qualitative data collector methods include the observational checklist, key informant interview, focus group discussion, participants of observation. Okay, but the three most common ones include the observational checklist, key informant interview, and focus group discussion. For the observational interview, they are used to observe the practice. Practice is commonly also assessed using questionnaire, but that one is what the respondents said. At times they don't tell the truth, so you use observational checklist to find out whether they actually do the right thing. In that case, you will have a checklist of what is expected, and then find out whether they do it. Whether they do it. Okay. Then the key informant interview. This is you have to interview those that have the best information. That those whose position means that they are able to give the right information. Like as we said, program officers, immunization, TB control, all the people involved in vertical public health programs, they are more likely to give you the right information. And at the community levels, if you want traditional medicine dealers, traditional medicine practitioners, women leaders, community leaders, and religious leaders, they are likely to give the best information. Depending on what their study topic is. Okay, and I must also say, if you are carrying out a study, you want to find out whether they do what they practice in a hospital or in any setting. Please note that hospitals or companies, they practice based on a protocol, what they were told to do. what they were told to do, and there are usually no much deviations. So if you are carrying out, if you want to assess waste management, healthcare waste management in the hospital, you can. There's no need for you to administer questionnaire to ask each of the workers. No. It is a waste of time because they will all do as is required in the workplace, in the hospital. So the best thing to do is to do a key informant interview. Just ask the head of department or anybody in charge, and he or she will tell you how they do it in the hospital. How they do it in the hospital. Focus group discussion, you use a group of persons of the same demographic. So if it's women, you look for elderly women, women of the same age. So you don't mix them up. You don't mix elderly persons with young persons because they will be restrained. They will be restrained. There are certain things the elderly ones will not want to say in the presence of young ones, and vice versa. So you have to group them. You have to group them according to their ages, so that they can freely give the information, so that they can freely give the information. Okay, so the next one is you have the study tools. You have the study tools. The next one is you have to use the tools to collect the data collection. And under this data collection, we're interested in at least two aspects. Let's just make it three. You tell us the time you collected the data, the time you want to collect the data. Okay? Because there are certain things, there are certain topics that have seasonal variations. If you are carrying out a study like malaria, it will be nice for you to tell us the month, so that we will know whether it is rainy season or dry season. Rainy season or dry season. That's one. The second one is that you must tell us the recruitment and training of research assistants. You are going to if you are going to administer questionnaire up to your sample size. It's a lot of work. We want you to state whether you recruited research assistants and how you train them. That's two. And then the third one is how you were able to assess the respondents. What did you do to be given permission to carry out the study? It is not, most times it is usually placed under ethical consideration. No, it is not. It is not. This one is letting us know how you are able to gain access. And this is very, very important. This is very, very important in public health, because public health has to do with working with the public. It is a key competence. It is a key competence that we want public health practitioners to demonstrate. That key competence, being able to go into the community to carry out your study, being able to get into the community to carry out the study. What has been called the community entry process. Community entry process is a key competence of public health officials. You must know how to get into the community, how to get into the community without getting into trouble, without getting into trouble. Usually, if you are going into a traditional community, you have to go and look at the community leadership, people that have been called, that are called the gatekeepers. When you get there, they are going to, of course, you get there appropriately. You know what to do. At times, you'll be required to go with gifts, including in the Niger Delta, you have to go with drinks and a small a token, a money that you have to also use to support the drink. They used to say that you have to wedge the drink, because if you don't wedge the drink will just topple and fall. Okay, so you have to, and in the north, perhaps you have to go with cola or something, a gift appropriately. Go meet the traditional ruler and explain their purpose, and then explain your purpose, and then they usually will grant you permission, or what has been called the social license to practice, or social license to operate. Okay, and then they can also even give you a youth who will take you around the village, explaining your purpose to respondents and making sure that you are not they are not molested. Okay, then even in the hospital, if it's a community hospital-based study, you have to tell us how you went through the process of securing the permission of the management of the hospital. Okay, so you have to include these three data collection, these three. Okay, then data analysis, you have to show how you will analyze the data. So apart from telling us the kind of analysis you will carry out and the statistical software and the level of significance, you must also show how you are going to analyze each of the specific objectives, each of your specific objectives. If you have 4 specific objectives, you are going to show us how you are going to analyze them. It is better to do that. Each data analysis, please, each of the specific objectives should have an error. Yes. So if we tell you, so if you are doing a CAP study, you must tell us how you are going to assess knowledge and analyze knowledge. Okay? Assess and analyze knowledge. Usually we want you to, knowledge is a test of questions. It must a test of knowledge. So, which means that to assess knowledge, you have to use exam-like questions that just have either one correct answer, so that the respondents will have a score. And with the score, you can place the respondents into whether they have good knowledge, or they have average knowledge, or they have poor knowledge. Okay, so you have to tell us that. For attitude is a predisposition towards something. So you can assess attitude using a 5-point Likert scale. A 5-point Likert scale. That's what I prefer. And you are using questions. And please, you have to mix up the questions. So you have to mix up the questions so that the respondents will not guess that all the questions are to be answered positively. Okay, so you have to mix up the questions and then tell us how you are going to analyze that. And at the end of the whole thing, you are going to score the responses of the respondents so that you can place them into whether they have positive attitude, indifferent, or negative attitude. Okay, and even for practice, if the practice is just straightforward, it's just straightforward. If they use family planning, yes or no? Yes, that is that. But what if it is if it has different components like hand washing? Hand washing, unfortunately, I've not done environmental health, but hand washing has to do with, it is not just to wash the hands. You must wash the hands in a certain way. You must wash the hands with soap. You must wash the hands with running water. You must rub the hands at least 3 to 4 times before, yes, 3 to 4 times. And you must wash the hands at critical times after going to the toilet, before eating. You must do that. So you will notice that the practice is not just one single act. It is several. So those acts you have to list out to find out whether the patient, whether the respondents have practiced them. And at the end, you can score them. You can score. If the respondents carried out, say, 70% of the acts, you can rate the person to have good practice. And if they practice none, or say 30% of what they are supposed to do, you can rate them as having poor practice. So you must show how to analyze each of how you are going to assess and analyze each of your specific objectives. Please, you have to do that. This is an aspect that is not commonly done, but we want to encourage you to do that. We want to encourage you to do that. And then the ethical considerations. Remember, you don't want unnecessary human harm. We don't want human experimentation. Remember, after the Nazis did what they did, after the Americans subjected poor African Americans to all sorts of tests, human experimentation, there is now what they call the Nuremberg Code that guide studies carried out in human beings. So after your proposal, you are supposed to get the approval of the approval of the ethics committee of our university before you can go on with your study. And the ethical consideration are, what are the ethical issues that are important in this year's study? You have to note them. You have to list them and do something about them. Do something about them. And you are going to look at these things. The first one is the informed consent. Informed consent. You must tell them everything about the study. Everything about the study, especially the purpose, the method, the potential risk, and even the benefits. Tell them about it, and you give them the option to either accept or participate without coercion. Without coercion, you have to give them that. That is very, very important. I will expect you to put it under ethical consideration. So it's not enough to say you will seek the ethical approval of the University of Port Harcourt Ethics Committee. No, it's not enough. You have to tell us what you will do, And what you will do will include these 4 things: informed consent, confidentiality and privacy. You have to protect their data and privacy. You have to protect their data and privacy. You have to minimize harm. You must minimize harm, even if it is pain. If you can access the records of a patient, there's no need repeating that test, even if it is without any cost to the patient. No. Yes. So if you are carrying out a study, say amongst say HIV positive patients, instead of taking another blood to test the viral suppression, you can easily get it from the secondary data. So that is you have to reduce harm as much as possible, and then you have to declare: do you have an interest? Conflict of interest. Do you have an interest in the study, in the findings of the study? It's either to prove or to disprove. You have to show, you have to clearly state that. So these 4 things you have to do: informed consent, confidentiality and privacy, minimization of harm, and then the conflict of interest. I don't know. I think I will pause here for any question or comments. I hope I have not lost you. Yes. Do you have any question, comments before we just take the final ones, which are the indices, appendices? Hello, best man.
Prof.
Yeah.
Hey, Prof, my question is coming from this ethical approval. In writing it, how are we going to getting the approval? Is it from the school, or we are writing it to the school for the approval, or we are just writing it to send to which platform, sir?
No. you will get to that point later, and we are going to give you instruction on how to do it. But for now, what you will be expected to just state what you are going to do. What is it? That you are going to seek the ethical approval of the University of Port Harcourt Ethics Committee, and then address those the 4 issues that has to do with informed consent, confidentiality and privacy, minimization of harm, and then the other one is the declare interest. Okay, so those are the things. Okay.
Okay, sir. Thank you.
Yes. Do we have any further question? No question. So we can just take the okay. Hello, Mary. Hello, Mary. Hello, Mary. Hello? Okay, so we can go to Linda. Linda.
Hello, Prof. Good evening, sir. Please, I want to get clarification on cluster and stratified sampling, because I was trying to understand what you mean when the units are not same and when they are same, like homogeneous, heterogeneous, and the implications, because I want to get a kind of practical example of that statement, sir.
Okay, I will do that.
All right, Prof.
Clusters cluster sampling is used for homogeneous data. You know the purpose is that the sample should be representative of the total. So when the population, they are almost the same all through from the beginning to the end, they are the same. It means that if they have a subdivisions, it means that if you take 1 or 2 or a couple, they can be represented, they can represent the others. I don't want to use orange or an orange. Orange has different compartments. Although there are some compartments that are smaller, but a lot of them are almost of the same size. If you take one and study, that one you have taken will give you results that are results that are applicable to the rest. So if you go to say, where will I say now? Okay, I know, but a lot of times, okay, if you, I don't want to give, say, so a place, say a ward, a rural area, your hometown, I don't know. When you know a lot of things now, it becomes very difficult to give an example, because I know that.
Explain, yes.
Yes, no, but they are taken as the same. They are taken as the same. They are taken as the same. But I don't want to say, because if you even in traditional societies, communities, there are inner. A community develops at the edges. So the middle of town, you have the older houses. So at the edge, that's why you have the new buildings. But the thing there is that in most times you assume that they are the same. And if they are the same, it means you can choose, like in a local government area, you can choose a ward. You can consider the wards as being the same. Okay, but for the stratified sampling, they are different, and because they are different, you want to take a little bit of them. So, for example, in River State, we have said that river states can actually be divided into three. The urban areas, the rural areas that are riverine, and the rural areas that are upland. So they are different. So if you want to carry out a study that is, you want to be representative of the whole of River State, you have to take into consideration these three strata, these three differences, and then choose one. You can choose from each of them. And if you are choosing, it means that you consider all the urban centers as a cluster. So if you choose one of the urban center, you will believe that if you choose one community from the urban center or one ward from the urban center, you will consider it as representative of all the urban centers. Okay. So that is that.
Thank you, sir.
Yes, I think okay. That the other lady has okay. It was Mary. Mary, you have changed your mind. Okay, so we can go to the appendices. These are attachments. These are attachments. They are not. Yes, they are not the main things, but we expect them in your proposal, and we even expect them to even form part of your dissertation, and they include the timelines. You have to set a timelines for your study, and you have to do a budget, make a budget for the study. The timeline means we want you to just decide how long will it take you to carry out this project? How long will it take you to carry out this project? And we want you to create what they call the Gantt chart. Gantt chart. In fact, it is also very, very good for us especially in epidemiology, MPH. MPH is a special program. That was what I started with. It's a professional program. In fact, yes, if you have a DRPH is for academics. A doctorate degree is for teaching and research. But if for practice, you just an MPH. So, and part of it is some of these skills or tools, some of these things, and especially the Gantt chart. The Gantt chart will tell you, it's a graphical representation showing the tasks to be done, who will carry out the task, and the time assigned to that task. We want you to create it. Let us know when you intend to start and finish this year master's research. We have realized that no, it's impossible to finish this program under 12 months. So we said no, okay, let's stretch it. And that's why we have brought in short courses, and we have broken the research methodology course we have stretched this research methodology course to make sure. So just tell us how long it will take you, and then the Gantt chart, okay? And you have to also be disciplined enough to follow the Gantt chart. I know that deadlines are not meeting deadlines. It's not one of your hobbies. It's not one of the things a lot of you are not strong in it. You are not strong in it, but that discipline, begin to get that discipline. Okay, the other one is the money. The other one is the budget. Although we are not going to give you money, but it will also be nice, it will serve you well to look at that, to find out how much it will cost you to carry out the project. How much it will cost you to carry out the project? How much it will cost you to carry out the project? And then with that, you can decide on, can you afford it? Can you afford it? And if you cannot afford it, are there cost-cutting measures you can adopt? For example, learn how to analyze their data. By, of course, some of those statistical softwares, SPSS, EpiInfo, you can. Yeah, we will give you the opportunity. Part of when you are getting towards the data analysis, we are going to teach you the use of those softwares. And then, as I said, this is adult education. You can actually teach yourself. You can, including YouTube videos and so forth. You can teach yourself. Okay, and then even other ways, like instead of printing questionnaires, you can use a Google form and other electronic survey monkeys and survey monkey and the rest, and other electronic questionnaire softwares. You can look at that. You can look at that. Even if it is interview administered, you can use your phone to, or buy, or even hire the phones or tablets, and you give to the research assistants to use for that purpose. So, and the good thing with using electronic questionnaire is the fact that they are easily analyzed. They are more easily analyzed because you don't need to input. You don't need to input the data from the hard copy questionnaire into a database. Now it's a click and you transport to SPSS and analyze. Okay, so you can look at that and those. So in carrying out, in doing a project, you can look at all those things. But first of all, find out how much it will cost you, and then the next step will be to tell us, to decide on how to cut costs. Decide on how to cut costs. Okay. So those are the two appendices. So you'll be expected to do a draft, and then you attach you upload on the supervision platform. When we are through with approving the topics and then signing your supervisor, will register you on the supervision platform, and then you can now upload for it to be reviewed. Okay, and hopefully it will be perfected before the date for the proposal presentation. A proposal presentation will be by PowerPoint. You are likely to write on Microsoft Word, and from the Microsoft Word, you will now develop a PowerPoint slides. You develop a PowerPoint slides, and you will present online. So you will be the one sharing. You'll be the one sharing. So within that period, before that time, we will teach you you'll be told how to share a slide, so that you don't make a mess of yourself during that period. So it will tell you, share a slide, and then you make a 10 minutes presentation to a panel. The panel will not just the supervisors. In fact, their supervisors will not make much contributions, because they were expected to make the contribution before now. So the other panelists will make their inputs, will listen to you, make their inputs, and you'll be expected to make the corrections. You'll be expected to make the corrections. Okay, and after you have made the corrections, the next step will be to design your study tools. The next step will be to design your study tools, which you will do with your supervisors, and then after that, you'll be you will send you complete the application form of our ethics committee to receive the approval of that committee before you can go to the field to carry out to collect your data. Okay, so we are done. I don't know other questions. Linda is hand is up. Linda, apart from Linda, do we have any other comments or questions? Linda, you can go ahead.
Okay, sir. Thank you for the lecture so far. I want to have get some clarification. Like, the implication is that if we are to go for proposal, we are not going with our study tool. It's after the proposal we cannot design the study tool. I want to get that, sir.
Yes,
okay,
because
Secondly,
the study tool is based on your specific objectives, and your specific objectives may change after the proposal, because the panelists they are likely to make one or two comments or one or two changes.
Okay, sir. Secondly, sir, please, I want to ask, like some of us, maybe you have a special area of interest that you really want to do. Can you present that special area of interest using different objective, different variables, like to get the 3 topics for that your particular area of interest?
No.
Okay.
You said 3. If there is any area you are particular about, you can just highlight it. You highlight it.
Okay,
I don't know. Should I even say that you should just even you can even put one. You can decide to just present one topic, but the implication is that if that topic is found not to be suitable, it means that you will have to be asked to make another submission. So that is the only drawback. That is the only drawback.
Because my interest has been in breast cancer, and I've been in that, so I don't really know. That's what I was thinking.
Breast cancer. What aspect of breast cancer?
Rehabilitation of cancer survivors, breast cancer survivors.
Through
the use of physical activity, the recommended exercise for breast cancer survivors, and also dietary. So,
you see what we are talking about? You see what we are talking about? Physical. If you are doing physical activity, which means it's an intervention, how long are you going to do it for you to begin to?
Not the intervention part, sir, that I'm going to do. And I be considering the access to information, challenges to those practices and all that, sir.
Okay, Linda, it's all right. But how many are you going to get? How many are you going to find?
Most times the population depends on the type of study. Like, if it's an intervention, you may have to maybe considering maybe those that
if it is a cross-sectional study now.
If it's a cross-sectional study, I might go through the tertiary hospitals and get the population from their data.
How many breast cancer survivors are you going to find?
For those that are still coming for follow-up treatment, if they are in the hospitals, they have their data, they have their registers, sir.
They are in the hospital?
Yes, they have their registers. For those that are still maintaining follow-up with the hospitals, they have their data in their system, and the days they come for follow-up clinics.
Okay, so you have an idea of the total number of patients that are being treated for breast cancer.
Yes, if I go there, I get it. Those that have completed primary treatment or those that are still on primary treatment. If I get there, I get it, sir.
Okay, you can get their data.
Yes.
Okay, it's all right now. I just hope we have not entered what my people call on top.
No, Prof, it's just because of area of interest, so that I don't present 3 different copies. I get the one that I might not be able to.
What I'm saying is, who are we now? Who are we to? We just approve it now. But they will be waiting for the sample size now. It's not once you are going to just go and tell us that you can't find them. But it's all right.
No, sir.
It's all right. You
Thank
speak
you,
like
sir.
somebody that have been seeing them. Yeah, Barry. Hello, Dara.
Okay. Yeah, good evening, Prof.
Good evening.
Yeah, it's Yabari. My question is the duration. My question is to research methodology, ICT research methodology. Are we going to have exam on this piece of our project and research? That's the number one question. Then number two, when are we going to start this project? Like we are starting immediately, when and how long was the, because I also saw the last statement here. So at each of these steps, at that time allotted, duration of time for each of these, approval, ethical approval, things we are putting in our calendar. And this our MPH. Are we still my ID card says the it's expiring December 2026, but I was thinking we are going to be ending by June 2026.
June what?
Just clarification, sir.
How we should just exit you by that period. But the truth is this, that this is actually not our fault. It is easy to do the taught courses, but for students to carry out their research and then present, it usually takes a lot of time. In fact, the previous set, it was just last month, no, this month now, November, that the first batch defended. More than 6 months after, more than 6 months, actually not our fault, but I wish that by June or even May, you are true. So that, anyway, I've said the truth. I've told you people the truth that it is only when you have graduated that we have that we are sure we have digested your money, your school fees. We still graduated that will stop spending. So it's actually in our interest for you to. Okay, you talked about courses. I hope you did the first end of week assessment.
Yes, I did.
This course is this course is actually a 2-credit unit course, but it is designed to give you the technically it's different from other studies. Sorry, it's different from other courses. Okay. Generally, the research or this whole thing is it is almost like it is at your own pace. You do it at your own pace. Like we have started now, this proposal, what we have just done, is to prepare you for the research topics. And we are giving you time. And hopefully we believe that before the end of the year, we'll get the topics approved and we'll have your supervisors assigned. And I can swear that even by the middle up to the middle of next month, not all of you would have sent in your topics. Not all of you. look at, if you look at this number, the number in attendance today, if I have to do close full disclosure, they are not up to 50%. And this is we admit, because we know that a lot of people drop out, a lot of people forget the program and come back and the thing. So after this one, we have also, let us also say that the proposal presentation will be in first week of February. We can assure you about that. First week of February, we have we'll do the final, we'll do the proposal presentation, and then when after that, it will be between you and your supervisors to arrange your study tools, and then fill the the form for ethical approval, and then you go ahead and collect your data. Okay, so it depends on you, and how I wish that by June 2006, all of you would have completed your projects. Okay. I don't know if there is any other comments or question. Edwina. Hello, madam.
Hello, good evening, sir.
Good evening.
Sir, I wanted to find out about the end of week test. For those who didn't do very well in that test, what's their fate? I just heard you mention it's a 2-unit course. So what's the fate of those who didn't do well in that test?
They will try and do well in the next test. I'm sure that you can even have up to eight of such tests before the end of this course, because we are stretching it. We are stretching it so that we'll teach you close to the time you need that information.
All right, sir.
Okay. Well done. So I think we are through for this week. So on Monday you'll be writing the end of week tests on Monday, and it will be on the police proposal presentation. Okay. Hello, Ezinne. You want to give a report of thanks?
No, sir. Good evening, Prof. Please, I want to know, when are we going to start making payment for the short courses?
Like yesterday.
So I want to know if we can start the course, maybe along the line we can make payments, or are we paying as we are doing registration?
No. Anyway, I don't know. I don't know. The thing is, what you can be sure of is at least one. Even if you don't have any extra money to pay, you can just register, choose one of the short courses, and that will be all right. Yeah. Okay. Well done. Yes, Alex. Alexander Ogochukwu.
Good evening.
Hello.
Sir.
Yeah, good evening.
Good evening, Prof. Okay, sorry, yeah. I'm on transit. Yesterday, I didn't join the lecture because I was traveling. Today, I'm going back. I didn't join the lecture. Please, we would like to get the recording of these lectures on time, if possibly today or tomorrow.
It's all right. It's all right. Well done. And save Johnny. Okay.
Thank you, sir. Then second, sir, hello?
Yes.
Hello, sir.
Yeah.
Secondly, the short courses we are doing, how many can someone register for, and how many is free for us that is doing the master's program?
One is free. The other one is, you cannot register the courses that are being done at the same time. Although we have Yes, at the same time. Although we are able to spread, they will hold 2 weeks, 2 times a week for 4 weeks. 2 times a week for 4 weeks. And each week there will be an assessment test. An assessment test. Yes. Okay. So that is how it is. Yeah. Overcomer. Hello, Overcomer.
Hello, sir. Good evening, sir.
Good evening.
Yes, sir. And sir, thank you for the lecture. I want to ask about the other 2 courses. That's entrepreneurship and this other one. I want to ask: are we doing that? Are we completing the other 2 this year too? And are we writing the exams together with this particular course?
The management and entrepreneurship will start next week. Will start next week. Would have made an introduction, would have done an introduction this week, but we wanted to just give a quality time in discussing the proposal. The course on environmental and occupational health will probably most likely take place next year. Next year. Yes.
Then the exam, are they the 3 together or?
No. This
yes.
The research.
Okay.
This one now, this research methodology, we are not going to have the exam immediately because we have not concluded it. We have not concluded it. Yes, we are not, but for the management and entrepreneurship. Management and entrepreneurship, we will look at what will happen. But they are not, they are just the courses inserted into the program by our graduate school. Okay. Yes. Yes. Barry. Hello.
Okay, sir. Prof.
Yes.
Sorry, I just my question is actually stemming from.
Okay. I thought I didn't want to call you Barry. Okay, I think okay. Well, yeah, Barry, you can continue since you have your mic is off.
Okay, sir. Okay, Prof. My question is actually stemming from the last speaker. So I just want to know technically what we have for our MPH students, for us MPH. We have technically 5 courses aside the project. That is this research and methodology, ICT research and methodology, entrepreneurship and management, occupational health, and one of the top courses, making it 4 plus the research, making it 5 left. Am I correct, sir?
No, the environmental, this environmental and occupational health, they are not separate. So what we are going to take now is the research methodology, the management and entrepreneurship. Then what will be remaining will be the environmental and occupational health, which will be done in January. We said the other courses will be captured under the short courses. The so-called elective will be captured as a short course. Hello, Kofi. No, it's not Kofi. I think yesterday you corrected me, so I was struggling. I wanted to remember how you pronounced it. You can go ahead.
Okay, thank you, Professor Best. So mine is just a bit of clarification. So the short courses mentioned, are they tied to the MPH program? So what I mean by that is, does it mean that we must have to complete those short courses before we graduate? Or is entirely independent from the MPH program?
No. They are not. They are elective. They are optional. Okay. They are optional, and of course, they are not going to contribute to your CGPA. But before we started the lecture, I was just trying to emphasize the fact that MPH is recognized globally to be a professional degree. Yeah. A professional degree means that the holder of an MPH is expected to have a certain level of competence. And that is what we want to emphasize, not the theory.
Okay.
Yes, not the theory. So if you go to the US or the UK or any other country and present your MPH degree, they will expect you to have a certain level of competence. Yes, and we don't want to, during the ethics course, we are talking about malfeasance and the non-feasance. Yes, you can be charged for malpractice if you fail to deliver up to the expected level, up to the level expected from your certificates. Okay, hello, Philip.
Oh, good evening, sir.
Good evening.
Yeah, thank you for your lectures. Sir, please, payment for the program, the main program, MPH program for people like me. No, we're struggling to try and see if we can clear it this year. But at the same time, we are also interested in these short courses. So I am now thinking, can we now pay? You gave us discounts of 25%. That means if we are doing 3 courses, which is meant to be 100,000, it should now be 75% because we are doing MPH. So can we pay for the short courses and leave out the main course in the interim? Because
you can.
Okay, all right, sir.
Yes,
thank you, sir.
Yeah. Okay, thank you very much. I don't know, it has been an interesting thing. Okay, it has been interesting. So we are going to Joanne.
Prof, good evening, Prof.
Good evening.
Sorry, I just wanted to find out the school fees for the main course. When does it elapse? Since this our research, this thing, we don't know when it will. So I want to know when.
Anyway, Joanne. Anyway, it was I was just joking, and when somebody was talking about his ID card, reading that will stop in June.
Yes.
Yeah, the thing there is this, we have suddenly, when we advertise the program, we advertise, anyway, it's still one academic section, let's just put it that way. But it has stretched. Yeah. We have found it difficult to complete it within, say 12 months. But we cannot in good conscience say you should pay extra because you are extended. We have extended. You have recognized that you cannot finish it within 12 months.
Yes, sir.
And you don't want to just leave it. What has happened is that a lot of persons, several times, they just will call them back. We just leave them, and then they will, after 6 months, they come back for their defense. Some of them have even forgotten a lot of those things, what they have been doing. So that's why we want to stretch these things, but at no extra cost.
Thank you.
At no extra cost. I was even saying that how I wish that just say, you have stayed 1 year, 12 months. That's okay. If you are going further, then you have to pay. Okay. So thank you very much. Kofi, don't worry. I don't know, Kofi. Let's go now. Kofi. Okay. Thank you very much. Kofi, you want to still say something?
Yes, Prof. I wanted to ask the defense. Is it as you come? Like, is it going to be when you finish?
Yes, if you finish.
Or is it going?
In fact, if you finish earlier enough, we can even put you with these sets.
Okay.
It's as you finish. Yes.
Prof, thank you.
So the defense is actually in batches. Like now for this previous set, we held one in this month. The next one will hold in second week of December, and the other ones will hold sometime in next year. Unfortunately, we don't even ask them to pay extra. It's not like the general in the university where if you extend once, even if you extend beyond, if you extend one day into the next section, they will tell you to pay the entire school fees. We won't do that. We won't do that. But a lot of persons, they just wait. They just wait, and then it's only when they see others defending that they will even get serious. In fact, the previous said that there are some students that are still collecting data. Okay, so thank you very much, and see you next week. Okay, well done. And
Prof, before you go, sir. Prof, before you go. Prof, before you go, sir. Prof, sir. Before you go, Dr. Pukumo. Yes, sir.
Yes.
Before this Monday exam, with the level of preparation, is actually biting on us. Because
Agasa, that thing that is just 15 minutes. So
I know.
First slides.
Preparation. I mean preparation. Would you want to show
you see, first slide? So you know.
So, Prof, what exactly are we writing this Monday exam now? Or what topic are we writing upon now? Exactly,
which one?
specifically.
It's weekly.
Yes, sir. But what are we writing now? Monday.
No. This one is on the proposal now. You did proposal this week, so it will just be on the proposal.
Okay. So the materials
will be made available. Will be made available. Yes.
Okay, sir. Okay, sir. Thank you, Prof. Thank you, Prof.
Yes, Ada, you can say the closing prayer, Ada. Hello, Ada. Hello, Chinemerem. Okay, thank you very much. I think we can end here. Next week, on Monday, we'll start with the end of week exam. That is questions also. I'm sure that you wouldn't have, you have not written any exam that easy.
Hello, Prof.
Yes. Hello, Ada. Okay. Thank you very much, and have the best of the rest of the evening. Enjoy your weekend.
Hello.
Well done. Ada, we cannot take you again, please.
Prof, good evening.
Yes.
Okay, sir.
Yes, please. Thank you. Thank you. Till next week. Yes. Yeah.
Thank you, Prof.
Have a lovely weekend, sir.
Okay.
Thank you, Prof.
Thank you, Prof. Have a
Thank you.
blessed weekend. Thank you, sir.
Thank you.